ready? I'm ready. Welcome back to the February 16th, 2021 Board of Supervisors special meeting. We're still currently receiving information from staff to provide direction to staff on priorities and study sessions for 2021. I would like to attempt to reel this in again. These five, so this is a general outline for a strategic plan that's been given to us. These five segments that, Mr. Toffanelli asked last time that we bring it back in the form that Mariposa had it. So this is a basic outline of what categories our strategic plan could have. I mean, right now, if anybody has any ideas of possibly adding a sixth category or, condensing two categories, because a lot of this stuff does cross over. But when it comes to this, we need to make a decision on, do we like this outline? Which things do we want? Which things do we not want on these headers? And then once we give that direction, the CAO can meet with the respective department heads, start getting their input, and then elaborate on the real nuts and bolts of what goes into this, because this is just a basic outline based on things that have come up before. Does that help anybody? I personally am okay with the five categories, and I don't really think we could change the name of one of them, to be more inclusive, like the education, the health and safety aspect. I mean, there's different names we could bring forward from different areas, but I think this basically captures the concept of what we need for base work to move forward. Any comments by the board? So with that, I'll take that we're okay with these five categories in concept. Yes. So we can give direction to go ahead and move forward to it, and once that, the input from the other departments at a later date, he can bring this back forward to us. Mr. CAO Alt, is that good for you for right now when it comes to the strategic plan?
Yes, Mr. Chair, that is sufficient. I'll include it in one of my goals along with bringing back the ad hoc and clear direction on that. But as far as the strategic plan, it pretty much puts this piece to bed.
Yeah, until a future date.
Right.
So we also have, do we have enough there to continue through study sessions to the middle of the year? Because I think at that point, we can bring back in June and just see how we want to structure out the rest of the year moving forward. So is that good enough? Do you have enough there now? And then I'll also, talking to you earlier, we may need to bring back the GSA thing earlier than later, just because that's coming to a head right now.
So in order, the study sessions, we would have them scheduled out now through the first half of the year, and I think it's prudent for us to discuss, at least get through some of the study sessions. They may be informed by other issues that come up, so we'll be able to schedule out the second half of the year in a month or two. So I think we're good to go there. And then on the groundwater sustainability, I do think we'll have to bring that item back. I had on kind of the rough drawing board bringing back an item for the board to discuss on the March 9th meeting, and it would just be an information item or potentially an action item for direction from the board on that particular item. So I think we'd have to pull it off the study session agenda.
Okay. If there's no other comments by the board, I'm going to have to put this out for public comment. Okay. Ms. Clerk.
I do not see any public comment at this time.
We'll give it a moment. Not that we're getting a lot of public comment recently. With that, I think we'll put this item to rest unless any other comments by the board members. Okay, thank you. So then we'll move to item number 5, discussion and direction to staff regarding possible resolution advocating for greater local flexibility and autonomy in responding to the COVID-19 pandemic. I personally brought this to the board, for discussion to see if you have the appetite for it. It's consistently brought up, by public health and other entities that, the state's constantly switching gears and directions, in response to COVID, which makes it hard for us as policymakers to move forward and everything. I mean, I personally don't see this as much as a political issue as some other people do, but I think it's more, to the point of be able to respond in a way that's best for Calaveras County. I did bring up, the Healthy Communities Resolution just to read here, and it's not anything that anybody has to agree with, or is what I have in mind to be set in stone, but I just want to read it to you, because beyond the people that originally put this forward, I think it's pretty straightforward to the point, whereas the paramount concern of policymakers at all levels, the health and well-being of our constituents, never more so than during what has been called a once-in-a-century pandemic. And whereas decisions affecting the health and well-being of our constituents must be based on empirical evidence without regard to politics or the influence of special interest groups. And whereas California has struggled as much as any state during the COVID-19 pandemic, with the third highest unemployment rate in the country, the largest backlog of unpaid jobless claims, and the fifth worst excess death rate west of the Mississippi, and whereas California's blueprint for a safer economy provides a one-size-fits-all approach to reopening communities that fails to allow the flexibility to respond in a data-driven way to what is occurring in our county. And whereas the blueprint largely impacts the operation of businesses and schools without any showing that those environments are responsible for COVID-19 cases observed in our county. And whereas our county has seen increases in drug abuse, delayed medical care, depression among our youth, and the overall need for mental health services. Let's scroll down here. And whereas our county is extremely concerned about the impacts to our children of any further delays to in-person education, now therefore be it resolved by the Board of Supervisors that these facts demonstrate a need for collective and unified action from our county and surrounding communities, and it be further resolved that county approve this resolution with a commitment to the following principles: that our county is best served by and ability to respond locally to COVID-19 virus in accordance with our local data and circumstances as specified, for instance, in the test station filed with the California Department of Public Health, that our county is geographically diverse and ill-suited for the county-wide restrictions imposed by the blueprint. And the state should enable our COVID-19 response to be tailored to geographically separate areas, such as different zip codes as circumstances and case levels warrant. That school districts in our jurisdiction are urged to safely open all schools as soon as possible and provide in-person instruction to the greatest extent possible without further delay. That the county requests an extension of time beyond December 31st to encumber and spend our federal CARES funds to which we are entitled by law, consistent with our respective local plans and programs. Now, this is just an example of what a resolution can look like. But I thought I would bring this forward and see if the board has appetite for this, and your thoughts. Ms. Calloway.
I don't know who the healthy communities are. I don't know who they are. Who are they? I mean, you said it's not political. I mean, we have an Office of Education. We have schools that are open. We've left it up to the local school district in cooperation with our public health officer. The educators are being tested. And if you go by zip code, that meant where most of them are in the west end of the county wouldn't be open. And then who are we medically to say, oh yeah, well, you know, Arnold, I'll just take mine, doesn't have many cases, so they can be open, but Murphy's does, so they can't be open. I'm not comfortable doing this. I heard Mr. Leach today encouraging people to get tested. It really is, it's happening. He thinks, you know, in a couple of weeks we might be in a position to go back into red. And I don't want to be, as a board, we've done nothing. And all of you know how I feel about that. We had a ordinance before us and we were going to educate people. We didn't pass that. So unless we want to assume responsibility, I can't support this. And then you have different rules and different zip codes or different rules for the county of Calaveras versus what the state is. And either we're in it together as a county or we're not. And I think we should be in it together as a county. I encourage people to get tested because it helps the west end of the county as well as the north, south, east end of the county. And I don't have an appetite to answer your question for this.
Understood. Any other input?
I'm as frustrated as everybody else with the state. I mean, I wake up every morning and read the paper and it drives me nuts, just like everybody else here. School's got to get opened again. We have to move forward. But, you know, much like, you know, our last letter we sent, you know, the day we send it is the day where it's out of date. It's just,
that's the hard truth.
Things are changing so fast that by the time this letter gets approved by this board, God knows what's going to happen. I mean, CDC guidelines are different now than the blueprint guidelines. So, I don't know, man. I'm frustrated with this. I'm not against it by any means. I don't know if I'm for it. I just don't know if I really know if anybody really cares what we have to say. I mean, we have to say it for our people. That's important. But, boy, I tell you, it's just such a moving target. It's tough.
Yeah. no.
So how's that? I'll take the middle road, saying I don't know. He doesn't know, I don't know. And since Gary threw it at me, I'll throw it back at Gary.
Well, until Gary puts his red light on. All the rural counties and rural communities and our more urban counties are all saying the same thing. And the frustration is there. And we're not alone. And unless we want to assume some responsibility, which I don't think we're there, I agree with Supervisor Garamendi. It's a moving target. Let's do what we can to help the residents and the businesses of our community. And if we want to write a letter to advocate for flexibility, I'd be supportive of something like that. But, what does that mean? And I think RCRC is already doing something like that, or encouraging that, CSAC is. But if we as a county want to write a letter, I'm not interested in doing a resolution, to advocate for flexibility. And what does that mean? What does that look like? Can we give examples? I'd support something like that in keeping with all the other maybe more rural communities in the state.
Mr. Toffenelli? Ms. Fullendorf?
I don't know, everybody keeps pointing at me. I read this thing and I saw the letter that came attached to it, and I understand where it's coming from, and I understand the frustrations, and the question, if we pass a resolution similar to this or something, we decide, okay, Maria says write a letter, she'd support it, or we pass a resolution. We pass a resolution, what are we going to do with it? Are you going to send it to Newsom? I mean, we passed this resolution, and the other consideration I have for it, because it's saying declare our independence from the state of California, are we going to cut our own throats when it comes to any funding that can be coming down through the state, or lessening the number of vaccinations that we get, vaccine we get? Are we, I mean, those are some of the things to consider. I understand what it says, and I don't disagree with a lot of what it says. But to take something as to what this says itself, with just passing what this says, I can't wholeheartedly stand behind everything it says, because we are part of the state of California, whether we agree to it or not here, or the people, our constituents, agree to it or not, because of what's happening in this day and age and with this pandemic. Either way, we are still part of the state of California. We're a subsidiary of it. And we have to go by what the state dictates, and whether we agree with it or not, whether we feel that it doesn't fit our needs, and I'm in total agreement of that. I think the rural counties aren't Los Angeles or San Francisco. We're not even part of the valley. What ties us to the valley, from my understanding, has to do with where our patients go, and where those patients go as far as counting beds, ICU beds and beds in the hospital. We send to the valley, Stockton and Stanislaus County. That's Mountain Valley MS transports them, ALA transports them to those areas. So we are tied there, and we're tied to what they are. It's kind of loosened a little bit with now going into the different tiers, and we're still a higher tier. But all in all, we are still a subsidiary of the state of California. To pass a resolution specifically like the verbiage that this says, if we're interested in writing a letter like Marita says, or drastically changing some of the verbiage in this thing before we pass it, I'd be interested in doing that. But this pretty much is saying we're cutting all ties with the state of California, and it's not something I would advise to do.
If I may, I did read a slightly different version than what you have in front of you. There's 10 counties that brought them forward. I chose one that did not have that verbiage in it. And I do agree with you that, just because we say so doesn't mean we're not part of the state. And I definitely took an approach, one of the resolutions that another county had that wasn't as strong as that by any means, for that very reason, because I wasn't wanting to go to those political extremes by any means. So I do agree with you on that. It's more so the one I read is making a statement.
Well,
and we've talked about writing letters before, and honestly, where's our letter go? Does it get read? I don't know.
Well, the resolution that you read was not attached to, and I tried to follow it as you were reading from what you were reading. Some of the verbiage is the same as what was in this letter here, but it wasn't attached to our agenda. So a preview of anything, it would have been nice if we'd had what you were proposing attached to this agenda item, so a couple of days of looking at it and making our own decision and copying, writing down what our ideas were on it would have helped. To sit here and make a decision on it right now without seeing it in writing form. And so, I mean, if you're willing to at least send a copy of that to all of us, or have the clerk send a copy to all of us, and maybe at a future date bring this back, we have time to look at what you have wrote, or what you put in proposing, and we have a chance to go through it and look at it, and maybe put our ideas on it and so forth, and then have a discussion. This agenda item doesn't have anything attached to it, so I had no idea what you were speaking of.
Right. Okay. Yeah. No. That's what it was meant for, discussion, not action. I can definitely forward that to each and every one of you, and then at some point we can re-agendize this if we so choose we want to. That's part of the discussion we're having here, was to find out if there's appetite for anything to those ends. Ms. Fullendorf, did you have anything?
I agree, but I think it's a wrong format to go. I would, if we wanted to make more action, and I understand you send letters and they get lost, but I think more of an advocating role or lobbying role might make better sense. Because I feel once we pass a resolution, we're going to have to hold ourselves to this. And what are we going to be holding ourselves to? What does that mean? What are we talking about? And I wasn't on the board last year when those decisions were made, but to Marita's point, there's not much happening. So how are we going to tie ourselves to this resolution if not much has happened from the board? And by that I mean holding individuals accountable, we all agree. We should not be put into the same box that San Francisco, Stockton, every other urban area and major cities should be. We agree on that. But
So that's where the discussion goes in. Why are we holding people accountable to things that are, that we don't agree with because we aren't San Francisco, San Joaquin County, and so on. So that's very much so the point, I agree. You know, and how do you hold something accountable? Somebody accountable for things that we don't necessarily agree with, you know? You say we don't do anything, but we didn't bring, what was brought before us last year wasn't just an education piece. It was like going out and finding people.
No, it wasn't.
Oh, okay.
It was not finding people, because I'm the one that had to make the motion. Because you all didn't make the motion, and it was what you wanted. I wanted some kind of enforcement. You agreed on 3-2, that we didn't want to do that. We want to do education. So we wrote, staff spent time, wrote an ordinance, came to the board. I asked for a motion. The three never made the motion. Mr. Garamendi said, Marita, would you like to make the motion? So here I am, making a motion on something I didn't support, because at least it was something. And we've done nothing as a board, but have our picture taken on the steps with our masks on, saying, wash your hands, wear your mask. So, all that aside, because I remember that one very clearly, we haven't done anything. And what about Tuolumne County? Tuolumne is much worse than we are. So we can't just sort of generically say all rural counties, because some rural counties are in a lot of trouble, and they're not urban, they're rural like we are, but they've had a huge case rate, a huge ICU rate. Even Amador's, we're doing much better than Amador is, and of course, much better than Tuolumne. So, to get back to, if Ben really wants to do something, if we want to write a letter saying we would like to advocate for more flexibility, and what does that mean? Do we then take ownership so we can say our restaurants can now serve indoors because we don't have cases, that are attributed to our restaurants? I can't say that. I don't know that. I don't know where our cases are attributed to. I mean, if it's something like what happened at Avalon, that's different. But our contact tracings aren't saying, well, yeah, they happened at this restaurant or that restaurant. I mean, they're not saying that. And we can't say that. If our medical people can't say it, I don't know how we can. It's only if we say we want to advocate for more flexibility generically. That's fine. That's flapping our wings and doing something because we probably all agree to that. But anyway, so it wasn't that we were going to find people. There was no support for any of that, any kind of enforcement like that. We wanted to do an education system, and there was no support for that either. I got to take a deep breath and meditate. Maybe go to the trees.
Respectfully, I remember it very much differently. But with that, Mr. Garamendi.
Rita, you just cracked me up. Maybe we need to pivot the conversation. I mean, Sam said the fastest way for us to get off the list and get active again is to get out of purple tier, right? And hopefully get down. Seemed like the easiest way to do that was to change our positivity rate. So maybe we should write a letter to our community and say, we're not having people die, thank God, lucky today. But if we want to get out of this, everybody needs to go get tested. Healthy people need to get tested. People who are healthy like you and I need to go get tested so we drive down that rate. And that may be a lot faster than lobbying the government. Just to get in this better rate, and we get all those things that Marita was talking about.
This is the thing I constantly wrap my head around, because now you're asking people that feel good to go get tested for something that doesn't make you feel good. You know, generally, I don't go to the doctor if I'm not sick, right? And I get your point. I mean, your point's valid, Mr. Garamendi. You know, but that's the way the state put this forward in this blueprint.
I know.
And this is very much why I want to have this conversation.
Yeah.
You know,
I mean, I got tested genuine the other day, and it took, I think I was, from pulling in the parking lot to pulling out was less than 10 minutes. It was just really easy. I know. Well, I was visiting with everybody there too, so, you know, seeing how everybody in District 5 was doing. So I don't know, Mr. Chair. I don't know what the appetite is, and I don't know what the right path is.
No, it's fine, and I don't need to have it either way. It's I think that we do need to have this conversation. You know, it's something that moving forward, there's, you know, the state's waffling. You know, it's one way today and it's another way tomorrow, and we hear that from our public health. And to Marita's point, you know, she uses it in one way, which I can't take from her, but at the same time, you know, the public health officials say that they can't prove it's the restaurant. The state's like, we need to punish the restaurants. And that's my point by bringing this conversation up. You know, we can't just keep dodging the conversation. We need to have it, whether we disagree or agree. You know, it's how do we advocate for our county to go in the best course forward? Is what I'm looking for. I'm not saying this is the end all stable by any means. It's just sparking the conversation. Gary.
Well, to Jack's point about what Sam said earlier today, that's very true, that he did say that we could, within a week or so, go back to the next tier, which is red, I believe, which would open things up. But there's no guarantee that the following week we wouldn't be jumped because of a spike, and he was talking about spike coming back, and what it is that we go back into purple tier. So that's, I think, part of the whole confusion with people and what's getting people upset, and I can understand. I own a business, and my business has been affected by it immensely, and I don't own a restaurant, but it affects all of us, and it's not like if you drop back a year ago, March of last year, this thing will be over by June. It's only going to be till June. And June came and went, and we're still wearing masks. We're still doing this. It opened up. People started feeling like the economy was going to start going. Restaurants were now inside serving food. A spike came. Holidays came. A spike came, and boom, we're shut back down. It doesn't mean if we move into another tier again that it's not going to be the same thing, or another spike comes because of a different variant, pushes things up, or so. So, you know, I'm open to the fact of, like I said, bringing this back. Send us a copy of what you read. Give us a chance to look at something and put our comments onto something, and maybe have this discussion again. Once we had a chance to look at the resolution you're proposing and having our comments put to it. Or at that time, we can even discuss, maybe Marita can put together her thoughts on a letter that she suggested and would support, and can present at that time we bring this back, what she's come up with on her letter that she would be willing to support.
I will do that. If there's no other comments, I'm going to go ahead and give an opportunity for the public to comment.
There is no public comment at this time.
Understood. So this was just a discussion item. I think I'm going to go ahead and follow Mr. Toffenelli's advice for them, what I have here. I'm in full agreement that the other ones, some of the other ones are a bit strong put forward. You know, I think something a little more diplomatic is the way to go, and possibly a letter is the way to go if the rest of the board so decides. So if we do end up bringing this back, we will give an option of this or a letter, and, you know, we'll keep our options open on how we want to proceed.
Mr. Chair, be sure you have the clerk send a letter, or send the resolution, not you yourself, to each of all of it.
Yes,
Yeah, send it to the clerk, have her distribute it.
Absolutely, sir. Good call.
Mr. Chair, as you mentioned, let's be diplomatic, because they do control the doses of the vaccines, and while I'm sure it's even and
Right.
equal and everybody's fine, we're also dealing with humans, and so, you know,
Yeah.
you understand.
Oh, yeah, absolutely. That's
They
why.
they could do a lot of bad things to us, and they could also do good things for us.
Right, and that's also why the one you heard me read, said nothing to the tune that Mr. Toffenelli had brought up
Right.
with the other one he had read.
Well, considering we are a subdivision of the state of California, as Gary said.
Yes, we are.
And please remember that we send all of the property taxes to the state, and then they send it back to us in allotments, so.
Yeah, if we're lucky. Some years they haven't. Okay, so we'll go ahead and close this item. So we'll move on to supervisors' announcements. In compliance with Government Code 53232.3D, board members shall provide brief reports on any meetings attended at the expense of the local agency and may make other announcements or report out. Any board members? Oh, you're all very quiet. Mr. Toffenelli. Oh, I'm sorry.
Amanda was
Ms.
first.
Bollendorf, you're first.
Last week, I was on a call with New Maloney's, and there were quite a few staff members from the county on there. It sounds like New Maloney's is working really well with Public Works to deal with the upcoming season that's about to happen with natural bridges. So Public Works is looking into some of the requests from New Maloney, such as more signs along the highway for no parking, as an example. And I attended Copper opened the new hotel, or gave tours to the new hotel down in Town Square, and then Dignity Health was there this weekend as well, promoting the new health location in Town Square. And they also had models available for tour in Saddle Creek. So there's a lot of things going on in Copper right now. And then Angels had a Valentine's weekend, and we now have the pickle porch. So if you're down on the other side of the crossing, you can still pick up the delicious tri-tip sandwiches on that side of the county. And that's all I have to report out.
Oh, I'm glad someone from this side of the county can bring our excellent tri-tip sandwiches over to that side of the county. Mr. Toffenelli.
Yes, I attended the Mountain Valley EMS meeting last week, last Wednesday, and the actual contract with ALA for provide service for Calaveras County will be coming to that board sometime in April. Once I get a copy of it, I'll make sure everybody here has a copy of it, although we don't, that board will control signing that and adopting that. At least you'll be able to see what the final outcome of that is. When we talked about it before and we voted before, it was to go and accept their proposal and go into negotiations with them. So it wasn't actually the final contract, but that will be coming in April. When I get a copy of that, I will make sure everybody here gets a copy so they can look at it. The other thing I want to bring up is it's been quite a while since we've done an employee evaluation on the CAO, and I think his contract calls for us to do at least a yearly one. So I'm looking if we could take a poll to see if we want to schedule some type of employee evaluation in the near future for the CAO. If we can do that, Chair?
Yeah, absolutely, we can take a poll on Mr. Falconelli. Are you in favor of that, Ms. Moldorf? Mr. Duramendi? Yes? Ms. Callaway? Yes? Mr. Falconelli? Yes? Okay, so,
Thank you. Thank you.
we'll be working on to bring that in front of the board in the future. Is there anything else? Ms. Callaway, anything to report? No. All right, well, you have a good week, and Mr. Garamendi? No? You have a good week, and everyone else have a good week. Thank you very much.